2 in understanding vaginoplasty. And in order to understand vaginoplasty even further, you need to understand the biomechanics of sex. So let's just reiterate. This is an example of an injured pelvic floor. So the vagina, again, is superiorly above, or the ceiling of the vagina is the bladder, the floor is the rectum, and this red line here represents the pelvic floor, which consists of our levator and ani muscles. The things to pay attention to is the thin pelvic floor between the rectum and the vagina, and the wideness or the separate muscles on either side of the vagina in comparison to the pelvic floor after vaginoplasty. The walls of the vagina are thickened, and the pelvic floor is also thickened, recreating a greater distance between the rectum and the vagina. Okay, great. What does that mean? I don't understand that. Well, let's just take a look at this model. Again, we have clitoris, we have rectum, and we have vagina. The area between the rectum and the vagina is the perineum. So important. With a thickened perineum, thickened pelvic floor, the vagina, the penis, finger, or toy enters the vagina at an angle. Why do we want to enter at an angle? The pleasure of a woman is on the anterior vaginal wall of the vagina. Well, why is that? Well, this is the clitoris. This is the hot pink button that you see. When you become aroused, this is the shaft, and then it dives in and disappears. This rest of the clitoris is inside of the vagina. These longer cruci are what holds the clitoris in place. The vestibular bulbs of the clitoris lie just within side of the vagina, and they become erect. When they become erect, that is what your G-spot area is. So women do have internal erections. So if the perineum is thickened, the penis is going in at an angle, you're going to rub on the anterior vaginal wall and the vestibular bulbs of the clitoris. Also, that angle will put the male's pelvis in line to also rub against the clitoris. Well, if you have an injured pelvic floor, usually due to obstetrical trauma, there is a widening of the muscles and a thinning of the muscles. Therefore, this thickened perineum is not there, and the penis, finger, or toy is going in horizontally, meaning less likely to push against that anterior vaginal wall. So when we do the procedure, we are going to be bringing in the muscles of the pelvic floor so that you can grip the vagina. We're also going to recreate the pelvic perineum so that we can have that downward angle of pleasure, so it rubs more so against the vestibular bulbs of the clitoris as well as the body of the clitoris. Well, is this all crazy? No. Dr. Goodman and Etal have done a study looking at approximately 346 women, and what they found is that women that have undergone vaginoplasty have over 87% satisfaction. In fact, their partners have seen an 82% increase in satisfaction after having vaginoplasty. So if you're watching this on Instagram, we're going to fade to black. If you're on YouTube, you'll see the real life clinical demonstration of what we just talked about. Now we're looking at and discussing the biomechanics of intercourse. Why would someone want this? We talked about what her desires are, but why this operation? Well, in order to understand that is looking, number one, at that first area we talked about as far as relaxation. So before having children, the perineum is very thick, meaning long, meaning there's a greater distance between the anus and the vagina, and that's on purpose because that creates a shelf. Now, when that shelf is present, the penis, finger, or toy goes in at an angle. As we discussed before, we know that the clitoris is here, the body of the clitoris is here, the crura and the bulbs of the clitoris are from up above, like we talked about before. So initially, you're going in at an angle, so that means you're going to get more pressure against the G-spot, and as well as the male's pelvis is going to push a little bit more firmly on the clitoris during intercourse. So after children, though, we have relaxation. And now the penis is going in horizontally. There's minimal friction both inside, and there's minimal pressure against the G-spot area. So as you can see, the goal is, one, to tighten the inside to create more friction, because we know that friction, sexual gratification for a woman is directly related to the amount of friction generated, as well as pressure against the G-spot area and the clitoris. So this is why we're doing the operation, to re-establish the perineum and tighten the inside.